Hey, caregivers. I wanted to have a chat with you today. So, we spend so much time looking at warning signs in our loved ones and just keeping an eye on them that a lot of times we forget to pay attention to the warning signs even in ourselves. Did you know that stress can cause many health challenges, including increasing your possibility of stroke? Well, May is Stroke Awareness Month, and I want to talk about stroke awareness with you. We'll touch on in this conversation today, we'll touch on a little bit what's the difference of a TIA and a stroke. But I want to remind you that being a caregiver, you need to take your health serious too. So, welcome to the Caregiver's Compass, where we guide you through the journey of aging, caregiving, and life's most important transitions. I am Virginia Webb. I'm a certified occupational therapy assistant. I'm a senior care transition strategist. I'm a licensed realtor and the founder of the Compass Senior Living Advisors. So, my partner, Crystal Goddard, she is not with us today. She is an occupational therapist, and we're here to help you understand the care side so that you can make confident, informed decisions. Together, we're here to help families navigate senior care, housing options, and emotional decisions that come with caregiving so that you won't have to do it alone. So, let's dive into our topic today. The stress of caregiving can absolutely affect your long term physical health. Let's be honest, when you're caregiving, your body can stay in a constant state of stress or even a constant state of fight or flight. When you're caregiving, you're worrying, you are many times you're lifting caregivers. That's a lot of physical stress. You're managing medications, you're not sleeping well. You're probably not even sleeping at all, honestly. Depending on what stage of caregiving you are in, you can be emotionally exhausted, physically exhausted, and mentally exhausted. And many caregivers are navigating their own doctor's appointments, meals, exercise, along with navigating those things for your loved ones. Over time, this chronic stress can contribute to things like high blood pressure, poor sleep, anxiety, depression, heart problems, and increased risk of stroke. So, many caregivers don't realize that their body is under pressure until something serious happens. So it is my hope to bring your own self care to your attention and the importance of your self care to your attention, and even be aware of your body, aware when you feel the changes in your body of how you're feeling. You may feel like you're having more headaches, or you may feel more exhausted. Just be aware of your body, and also to encourage you to seek for help. If it's get your own doctor's appointment. If you cannot go to the doctor because you're there with your loved one, nowadays they have telehealth. So look into maybe looking at telehealth to talk to a doctor, talk with someone. They have counseling sessions where you can do them over the phone, do them online, advocate for the resources that you need for yourself. So now we're just going to talk a little bit about what's the difference between a TIA and a stroke. I'm just going to talk about it just a little bit so that you can understand the difference, and then we're going to move forward in talking about things that you can do to help yourself. Now, let me say, by no means am I giving you medical advice, nor am I a doctor or a medical professional to give you any type of advice. I am giving you general knowledge that you can look up online. Uh, but I want to just make you aware of changes in your body. If you feel any changes in your body, have any care concerns, call 911, call your doctor, call your medical professional. But I just wanted to make you aware in Awareness Month of things to look for when living a life of constant stress. Okay, so the difference, and I'm going to be really general here, like this is going to be like a minute. So, really general with the difference between stroke and a TI. Stroke, think, okay, so blood flow is being blocked, interrupted on in your brain, and it's more severe. I told you general, and TIA is kind of leading up to a stroke. So it's called a transient ischemic attack or a mini stroke. And so it's temporary, but it should never be ignored. Again, call 911. A lot of times as us women, I don't know the statistics in women, but I know me as a woman, me being a caregiver, I know we push through a lot of things thinking we are going to be okay, thinking that, oh, this is just another whatever. And we push through so much, and we as women need to learn to stop pushing through things and pay attention to things that are going on in our body and stopping for a moment and trying to identify and figure out what that thing is. And if it's more serious than we thought, we need to take our health serious. Um, in this season, also, just think about the TIA, those many symptoms, and I'll give you a few symptoms in a minute, as alarm sounds and warning sounds that possibly something serious is on the horizon. So I need you to start paying attention to you, start resting, start taking a break. Call the doctor, go to urgent care, go to the ER and see about yourself, okay? Let me say this. One of the biggest mistakes that people make is waiting too long to get help. Some people may think, oh, maybe this will pass or I'll sleep it off. Oh my gosh. And I don't want to bother anybody. Those thoughts of, I'll sleep it off. I don't want to bother anybody. Those thoughts are wasting time. Again, call 911, go get help. I would much rather it be a false alarm and maybe a panic attack or something. I don't know. Than be a serious issue such as a stroke. But I would hate for you to brush it off, and it is a serious issue. So again, the faster you get treatment, the faster treatment begins, the better your chances are of recovering. So don't just brush it off. Go get help and call 911. So we're going to talk about warning signs. So some of the warning signs are things like face drooping. Does one side of your face droop and it looks uneven? Arm weakness. Is one of your arms weak or numb? Speech difficulty. Is your speech slurred or hard to understand? If any of those warning signs is happening or has happened to you or as a caregiver or even your loved one, dial 911. It is an emergency and go check it out, okay? Don't waste time with treatments and trying to do something and run and do, no, call 911 and get help immediately, okay? Other symptoms are sudden confusion, severe headaches, vision changes, dizziness, trouble walking, and numbness in one side of your body. So, those are some things that I want y'all to pay attention to, caregivers that's under all of this stress. I think 3 of the awareness months that I've talked about: mental health awareness month, senior awareness month, and then also there is a stroke awareness month. There's so many more, but those are the ones that I've addressed so far. And I hope that I'm bringing some information to you all that is of value to you. If I am giving you information that is of value to you, let me say right now, please like and share and subscribe to our YouTube channel where we are really um, uh, adamant about and trying to make a difference in the caregiver space. So many caregivers feel like they walk on this journey alone. They feel isolated. They feel like life and time is going past them, and they're stuck in a time warp of caregiving. And that is a reality of many caregivers and how they feel. But I'm here to let them know that they are not alone. They have someone that cares for them and is here during their part to make sure that they know that they're not alone and they are supported. And if you have any questions, if you have anything that you would like for me to talk about, that you would like to have a better understanding about, drop it in the comment and I will be sure to address that as best as my within my ability and my knowledge and understanding. And then lastly, we're going to start doing tours. We're going to start doing real estate tours of facilities because a lot of times caregivers have gotten to it's beyond them. And so when it becomes beyond them, they need help. And so now they want to look for a place to send their loved one, a place where they can be at peace knowing that their loved one is okay. And so it is my goal to create tours to be able to help you in that because it's difficult going from place to place trying to make that decision of where can my loved one be that I feel comfortable leaving them there. So I'm going to create a space of tours and you can look at online to see if this place is the right place for your loved one. Now, let me make the disclaimer that I am in the Houston, Texas area. So my tours will be in the Houston, Texas and the surrounding areas in the near future. All right. So let's get going in the rest of this segment so that we can move on the rest of our Sunday. So now let's talk about you. Here are a few tips for caregivers to reduce stress and to support your health. Okay. So the first one is asking for help. So you don't have to do this alone. If you don't have like siblings or something to help you, ask for help in your community. Ask for help um, at your doctor's office. Cry out for help, whatever way that you can. If your loved one is on hospice, I've done videos. If you look back, we have videos about what hospice is and how hospice can help you as a caregiver. They have things like respite every month. You can get a week, 5 days, I believe it is. You'll have to go back to my YouTube video to get the details. But you can get a week where you can kind of get a break and your loved one can go somewhere and be taken care of while you breathe. Go take a vacation and get a break to recover. Schedule times of rest. Rest is not lazy. Rest is healthcare for you. Rest your body. We all need to kind of just relax without feeling fight or flight like we have to jump up every minute to see what's going on. Try to be intentional to get rest if you have those resources of family and friends, cousins, aunts, uncles, brothers, and sisters, whatever your case may be, to ask for some sort of help, even if it's an hour to go make runs, 3 hours. On a weekend or something, a block of time, take advantage of those times of help and resources. Also, move your body. So, even short walks, if your loved one is able to walk, if you all go on a walk, a short walk, go to a park, just take in and relax and enjoy nature. Those are ways to bring down stress and bring down blood pressure. Staying hydrated and eating a balanced meal, trying to stay away from processed foods as much as possible, but eat living foods to bring life to your body to help you to be healthy and whole. Skipping those caffeine days. Now, some people we have to live off caffeine, okay, but try your best to look up foods to bring that give you energy and to try to substitute some of those days of caffeine. And then keeping your own medical appointments, going to the doctor to make sure you stay on top of your own health. A lot of times caregivers postpone their caregivers appointment, their appointments because they are caregiving. But really fight to be intentional to make sure you keep your appointments. And like I said earlier, if you cannot go into the doctor, see if you can schedule a virtual visit if at all possible, but do not ignore your symptoms, okay? Creating a small daily moments of peace. It could be prayer, it could be a time of playing worship music while you're moving around the house. And you'll be amazed at just like having worship music on, whatever your preference is. My channel, I am a believer and I'm Christian. And so that is a part of my journey that I would like to share that has been impactful to me, that has helped me, that may help you. Things like deep breathing, taking a minute to sit down and journal, create a vision board or even a vision photo album of what you want to see your life uh, be like in the future, to keep your hopes up, to keep your expectations up, and to keep you expecting that you will see those things one day. Sitting outside, taking deep breaths, right? Even if it's 10 minutes, it can help you regulate your stress. And then building community. Isolation increases stress, so support really, really matters. And so I want to encourage you. I want to encourage you that every caregiver watching me to remember that your health matters too. You are valuable. You are needed, and challenging seasons don't last always. Seasons inevitably changes. And then I want you to take care of yourself and understand it is not selfish, it's necessary. And then lastly, if this video has encouraged you, have taught you anything, please make sure that you subscribe and share with your fellow caregivers and people that you know that are caregiving. And if you need a community, somewhere where you can find support in your caregiving journey, come join us on the inside of our inside of our Facebook group, the Caregivers Compass Facebook group. You put that in, go to groups and you put in search, and it is the Caregivers Compass. It is a private group, but it's easily found, and you can come in and share there in a space that is non-judgmental and there to support you and walk with you through the journey of aging and caregiving, and life most challenging transitions. So thank you again for joining me here on the Caregivers Compass, and I will look forward to seeing you next time. Have a great day.